Well, hello everyone. Glad you could join us tonight. Tonight we have a special couple with their daughter, and you'll be able to hear of this beautiful story of how light therapy has been able to help this family. So I just want to mention that tonight, if you joined us, you'll be entered in as a ballot for winning the Palm Ultimate. That's this device here. It has the one wavelength, which is the 660 nanometer wavelength that a person can use on every part of their body, as well as the 810 nanometer which penetrates really quite deep. So just to give you an idea, there you can see the light going right through my hand. That's how much energy we have on our devices. These are medical grade. We have FDA and Health Canada approval on these devices. And yeah, one of my friends calls it, no, it's not medical, it's military grade. So we have a substantial amount of light power. Now, this happens to be the Palm Ultimate, and if you, at the end of the month, every month, we do a random draw of all the ballots that are entered. So if you watch us 4 times during the month, you get 4 ballots put in. So that's our Palm Ultimate. And since we'll be discussing our helmet, I'll just show it for a minute here. The use of the helmet. This is our helmet right here. And this device here has, so it just goes on the head like this. And yep, just like this. And then it has the red wavelength of 660 nanometer and the near infrared wavelength of 810. And generally what happens then is a person would do like 1 minute of the red and 3 minutes of the near infrared as a typical treatment. So what we're going to do now is we're just going to go into one of the videos that we have, and then we'll get right into our program.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cells super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your finger, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
So now we're going to introduce a couple that I pre-recorded, Carrie and Bob, and they will be talking about the use of the both the helmet as well as getting overall light treatments with the large canopy device that we have, and you'll be able to hear the successes that they've been able to see. And so we're going to get into that in just a moment, but I just wanted to share one other exciting piece of news that just came out is the we have also a case of a young girl that's had significant improvement in her seizure situation. She has gone from uh, 10 to 15 seizures a day, now down to one seizure a day. And we're going to be publishing that in a case study coming up in the next month. But it's really exciting when this girl can now have one seizure, sometimes less, a day on average, since ever since getting to use the helmet. So let's go into our video now, and you get a chance to hear about Bob and Carrie.
Hi, Carrie. Hi, Bob.
Hello.
How
Hello.
you doing?
Pretty good.
That's good. I'm glad you could come on this interview. And so I guess first off is how did we first end up meeting? Or how'd you hear about us?
I guess it started off, I had back in March 2025, had a small stroke that affected my visual cortex. And we were familiar with somebody a lady named Judith who does the Feldenkrais method. And she knew of your work and recommended we connect and try red light. I just started some vision therapy, so I started that back in, I guess, probably April 2025.
Okay,
And then in about May, we found out about red light and started exploring that as well. So I do vision therapy in conjunction with red light. So we've been
right.
coming to your office probably either 2 or 3 times a week for, I think we're up to like 100 sessions since we started. So.
Okay. And so at the early days when you first had the stroke, now tell me a little more about that. What happened? Do you know anything leading up to it or
So it
what?
just basically, I just had a really, really nasty migraine one day, and it seemed to just pop out of nowhere. They've never really found a cause or source. They found that I did have a hole in my heart. So they basically said if we can't find a reason for it, we're going to close the hole. So they did that back last September. And then once I found out about that, just exploring the heart and that, we bought a Palm and we use it kind of every couple days or every day where we can fit it into our schedule. Um, and the vision is kind of like a pie slice. Started off like a pie slice about here, and it's peripheral vision, not full vision.
Did that
And
happen right away? Like right the
it
day
it
after, or
it,
when did
it
that?
probably happened within a day or two. I didn't really recognize it because it was only movement, like peripheral. So peripheral had to go through that pie slice, and I've had lots of migraines in the past. I hadn't had one for 10 or 15 years. So it was a bit odd. And then when it checked it out, they found out it was what's basically a vision only stroke. So it only, I guess 1 in 10 strokes are actually only affect people's vision. Some people never even know they've had one, depending on the impact.
Right.
There's basically this pie slice. So any movement through that pie slice, when something's moving, I can't pick it up necessarily. And that pie slice has basically got smaller over time with the red light as in conjunction with vision therapy.
Beautiful. And it was your optometrist that I was, or the person working with you that I was able
Yes.
to meet up with as well. And
Yeah. And since then, she's actually bought a helmet, I think, and a palm to incorporate into her practice.
yeah, she was pretty happy with what she's seen, and that was neat to see. But to have a person that has that kind of knowledge as a doctor and to be open to light therapy is pretty amazing
Yeah.
because that's far and few between. But I think
Yes.
it's happening more and more that people are starting to wake up to this kind of light therapy and what it can do.
Yeah.
So you've been able to see better. You don't have as much of that
Yeah.
viewing.
That pie slice where it was like pushing a quarter of the vision in the peripheral. Now it's getting much less.
So, what else have you noticed with using the light? Was it for yourself or Carrie? That
So yeah, I've used it like it's almost like little aches and pains or a joint problem. I'll use the palm on that. And those are almost like little things on the side now. The vision is the big thing, and it's like if you get a sore knee or you bump it or something, you use it for a couple minutes, and then you just get up and move and go on with your day. It's not like a big event where you got to take a
right,
break for a while or you're off out of commission for a day or whatever. So all those little things, I'm automatic go to the red light and use the palm for just mopping up little issues that are
right. That's for those that are wondering what is the palm. That's this device here, and it's disappearing in the video, but that's the palm light there that you were using on different spots,
yeah,
as well as coming in here. So and so it's generally worked for just aches and pains on the rest of the body,
yeah.
as what you've used it. Now, have you, Carrie, you've as well used it, or what
Yes,
have
I
you?
have. I think
Okay,
the most I've been pretty busy managing the care for different people, so I haven't been. I did go in specifically to address some troubling issues on a thermography, breast thermography. So I haven't been back for a retest, but when I get that, I'll let you know.
right,
Um, the biggest, I think, changes in the family have been with our daughter Samantha, who's
right.
26, and she's had when I tried to summarize the list, it was quite long as far as changes that we've noticed after we're in the process of getting those 102 treatments. So, things
Okay,
like
yeah. So tell us a little more about that. So, what has your daughter been diagnosed with? Um,
Cornelia de Lange syndrome, which is a genetic uh, syndrome that affects head size, feet and hand size, thinking, some bodily function, depending on, like, could be heart issues. Um, just kind of, it can affect a lot of different areas, but those are the ones that we've noticed the most about. Um,
okay.
so, but it's the thinking, like, but weird things. Like after Bob had a stroke, we were as a family under a lot of stress.
Oh,
Like
yeah.
before the stroke, we were under a lot of stress. We had parents moving into long-term care. We had and all the trauma that kind of leads up to that, just those changes. Um,
Right.
so everybody was under stress. So we noticed that Samantha was getting, for the first time in her life, psoriasis on her scalp. Like, and you would get like stacks of cells uh, overnight. Like you'd clean them up kind of when she went to bed, and then there'd be a stack of cells by the morning. So, the psoriasis pretty much is like, if not, it's not totally cleared up, because if there is a stressful time or something's going on in her brain, then there might be small little patches of psoriasis build up. But if everything's going okay for her scalp is like clear as a whistle. So, and I attribute that all to the helmet treatment.
And also that was we know is basically after about probably six treatments with the helmet, there
Right.
was a dramatic like 85-90% drop off in the psoriasis. So that was a very, very short dramatic impact of
Right.
basically cleaning it up. And she comes with us to do helmet treatments a couple times a week. So I'm not sure whether that maintains or if we stopped helmet, whether there'd be any change, but it's basically pretty much mopped up.
The first day after her helmet treatment, she was able to navigate a heavy object upstairs, where before it would have been a problem. Doing dishes, she was able to open the stove drawer to put something away with just her foot, not grabbing onto something to steady herself, and then close it after she had put it in. And those are huge things for her, because she wasn't very steady on her feet because they're so small. Um, Her organizing of thinking, she she would try a task before, and if it would work, great, but if it didn't work, she couldn't come up with another solution to try. Where now she has the ability to do some problem solving and just orient herself a different way. She's way more aware of her own body in space and how she can affect change by moving it or the object to solve a problem.
I guess one example of that is she
Yeah.
loves going out and shoveling snow in the winter in the driveway. And in the past, she would her shoveling would be kind of just random all in every direction. And once after a bit of the red light, she started doing these very methodical, like most people would do, back and forth, perfect lines, everything, not a inch of snow anywhere. So just that type of organization and being able to solve a problem, and instead of just going haphazardly, it was a
Wow.
huge change.
That's interesting.
Her speech
Continue.
is also hugely different. Before she would have like one or two words to communicate in a thought. And the quality of her words, she'd be dropping the consonant at the beginning of a word. So it was, unless you knew her, it was really hard to understand what she was trying to say. But we got to the point where she's putting full sentences together. Her words are clearly enunciated. She's using words that I know she knew, but she'd never used before. So, it's pretty life-changing as far as her being able to show up with other people now, because she can communicate better and they understand what she's talking about, and how they know now how incredibly funny she is, and just what a joy she is to be around, because she makes jokes. She's just great that way.
Would you
So
say she had that? Did you notice that before the treatments, or was it very subdued?
no, it's very, all of the things I'm telling you are about since the treatment started. And it's been a gradual improvement in a lot of different areas. It seems like the body and the brain kind of takes opportunity at different times to work on the speech, or work on the cognition to shovel the driveway, or the alignment and seeing things and her position in space. But one of the most dramatic things has been her menstrual cycle. It was all on all the time before this. After a couple, I'd say a month or so, 2 months, her period stopped, which was just such a blessing for us. It was a major break, because it was just an ongoing
Constant.
thing. Yeah. So a couple months after that, things went a little crazy. Like, it was almost like her body had to reset, because her speech went down, her eye would turn, all the things that she had kind of got together in the last few months all fell apart. But then within, say, a month of that, then the speech kind of came back, the eye control was back, and her body actually, a month after that, tried to do a little test period, which didn't do much. 27 days later, she got a normal cycle. But then we hit a bit of a rough patch with stress and eye therapy. Just, there's been a lot going on. So she's regressed a little bit as far as the speech, and the period is now stopped. It didn't kind of fall back into cycle like we were hoping, but I have huge hope that with time and more treatment and other things we're doing as far as diet and just different changes we're making, it will respond, or she will.
Yeah, sometimes that is the case, that it's kind of like a pendulum. You got a pendulum pulled so far to one side, and you work on getting it to the middle where it's going to be stationary, but sometimes you do have some swing back, where it's kind of like going back into an area that you thought, oh, I thought we dealt with all that, and it comes back. But it's nice to see that after that period of time, like you're saying, a month, and you still have working through things, but you start seeing all those things come, starting to align better with more things added to it. So I'm very hopeful that you'll be able to see continued improvement over time, and hopefully not too many times swinging back a little bit. That's it's kind of like, oh.
Yeah.
But yeah, no,
We're
that's
confident
good.
though. and there's so many things in this world that are tugging against, moving forward, whether it's, toxins in the water, the air we breathe, like your body's like kind of right full of stuff. So, we're making efforts to just be as clean as possible as far as what our body is intaking, so that when we do the light, it has as much effect, and it's not cleaning up other stuff. It's,
Yeah.
dealing
Yeah,
with the
exactly.
problem.
Exactly. And another thing that could be too is we're right now going through the winter season, so
Mhm.
you're not getting the vitamin D, natural vitamin D from being out in the sun as much. And so that could be also part. I mean, how many people suffer with seasonal affective disorders? It's sad.
Uh,
And I don't know. One thing just came to mind here is that might be a good thing to start off the morning with a very bright white light. Don't know if you thought of that, but I know we're starting to get into the close to the spring months where there's a little more sun starting to come through and see it. But might be a good idea to start seeing if that can also help with the circadian rhythm. Have you noticed any difference with sleep patterns? Was there ever a problem, or has it been pretty okay in that front?
She's always been a good
Down
sleeper.
sleeper.
Yeah, she goes to
Okay.
bed. She like yeah, and she gets
Okay.
pretty much a full night. So
All right. Well, maybe the circadian rhythm is not something that, but anyways, a lot of people do have challenges with the winter season, and
absolutely.
it's a case. Some of it, yes, we have red light with our helmet, and that's wonderful. And then red and near infrared to penetrate the brain into the brain. But the blue spectrum, first thing in the morning, is really important for the body as well. And more and more is coming to that. Start seeing these, they have these lights that you can turn on to first thing in the morning. But
Mhm.
generally, if a person just took a 100-watt light bulb with that you screw in, and it's a better quality bulb like a Philips that has a high CRI, and also high Kelvin rating. So Kelvin makes it's like whitish blue, so it's kind of like a cool white. First thing in the morning is probably the most beneficial for that kind of thing. But I kind of digressed and went off topic here. But anyways, it might be. I just thought maybe it's might be something you might want to for 10 minutes first thing in the morning. Might be something that helps. I know of people with severe depression through because of the sad um, seasonal affective disorder that they saw great improvement by doing that. How is her mood about things?
uh, she's happy because she's being better understood. She finds a place in society. So, like, eh, you know, before she was always mostly an observer and wouldn't interject or be. So now she can be more part of what's going on around her. And she's a very people person. So that makes her happy. Um,
Beautiful. Yeah.
yeah.
No, that's great.
And not having a run on period all the time, like, that much blood loss, like, just if you get the sleep, it doesn't necessarily replenish you as far as the energy goes. But so I think overall, there's lots of things happening that are working towards health.
Well, we'll definitely have to have a follow-up in a while from now and see how she can, and hopefully she continues to improve in different areas. But I'm so thankful to have you on. Is there any other thoughts you had, last minute thoughts of anything you'd like to say? Were you, I guess one thing is, were you kind of skeptical the first time when you thought of this red light therapy stuff?
I had read about it in the past, like the past several years. I do a lot of just personal research and that, keep up on science activities and
Okay.
that. So I had kind of touched on it briefly, but never really dove into it or took it seriously. Was always open to it. I'm open to a lot of stuff. So, but no, I can't say I would have considered it in the past necessarily.
Mm.
Partly
Okay.
because there wasn't any urgent need. Like when
Yeah.
Bob had the stroke, he lost his license in the process, right? So it's really important that we work towards anything we need to do to get that back. So he's I don't want to speak for him, but he's got to the point where after the next block of neurotherapy that he's hopeful that he can get retested and get his license back. So
Oh yeah, that in itself is life-changing. So
Yeah.
hopefully everything goes well for that. Any final words? Anything?
I just wanted to thank you for
Oh.
allowing us to come to your office and using your helmet and and the bed. Like it's no other manufacturer that I know of does that. So thank you so much for your kindness and generosity.
Okay.
The only other comment I'd make is like we come for the canopy a couple times a week. And I always wonder sometimes, like everybody's there to using the canopy or the helmet to fix some immediate problem. But like with the canopy, I always wonder what impact it's having on other things that we're totally oblivious to. Like
Right.
when you're hitting your whole core of your body with the full canopy, like I always wonder what else is being affected and improved that I don't even know about. It's
Right, because you're
interesting thought.
definitely, yeah, very interesting. As a preventative, who knows
Yes,
what prevention is happening.
exactly.
Um, and also just having the blood that's going through and getting irradiated by this is all getting supercharged.
Yeah,
So, taking on things like you say, you don't know that are there or
yeah,
could be.
yeah.
And general health could be, maybe you get a few less colds that you
Yeah.
might have had
Yeah.
otherwise, right? Because
Because
you're,
one thing with the Palm, if I don't have a lot of time to do a lot of sessions at home with the Palm, then I'll
right.
just take it and hold it over my heart directly,
Oh, perfect.
and just because all the blood ultimately is going through your heart. So my
Yeah.
logic is that everything's passing in front of that light. If you do it for 5 or 10 minutes, that's usually what I do. And I did. It's almost like you feel a battery charging up in your system, which is interesting. Nice feeling.
Very good. Well, thank you very much, Carrie and Bob,
Thank
for
you.
being on this interview and sharing how light has been able to help you. Um,
Excellent.
all the best. Thank you.
Thank
Thanks.
you.
Well, I hope you really enjoyed that. We'll get into just talking a little bit about the product in a bit, but I want to welcome on tonight Dr. Susan Sebestyen, who happens to be the optometrist, the doctor that was working with Bob. And we're bring her on very, very shortly here, as soon as she can come on. And she can add some of her insights as well.
All
How are you
right.
doing?
I'm all right. How are you?
Well, it was great, great. It was really neat to get to meet you in Florida, of all places. It was beautiful
Yeah.
there. And
Yes.
we were trying to figure out how we'd meet, and we were both in Florida at the same time, not far
Yeah.
from each other.
What
So,
a coincidence, eh?
yeah.
Yeah.
So, you got to getting to use the light yourself as well.
Yep.
And
I have, as well as my son and my husband, and we're going to use it in the clinic as well.
oh, that's beautiful. That's
Yeah.
beautiful. So,
We're gearing up.
you're gearing up. So for yourselves, this is the helmet that you're using or you're
Yeah.
trying out. And there's the red for everybody at this part where they tuned in maybe a little late. That's the red wavelength. And then we have the near infrared wavelength, which is happening, a little bit purplish dots, but that's what you have. And just curious, you may or may not have noticed anything in particular, but have you noticed a little better sleep patterns or anything in particular in the use of the helmet?
Um, Not particularly, other than dry eyes are less significant.
Okay. All right.
That's my issue. But then I was listening to Robert talk, and I do think that if things are relatively okay or normal, maybe you might not realize the difference that much.
Right. Right.
I think that.
Yeah, if everything is functioning very well upstairs.
Hmm. Yeah.
So, so tell can you talk a little bit about this specific case?
Yeah, actually, I heard about SunPower LED from Robert. Robert came in to see me. I can't remember how he found me, but I have attempted a few cases in the past of patients who have lost their vision due to a stroke. And we have done vision therapy to help them regain their vision, which I have to emphasize that 99% or more of optometrists wouldn't even start,
Yeah.
wouldn't even consider. And Robert's vision was pretty significantly affected, and so were the cases prior. He came to see me last year,
Mhm.
and we started vision therapy with just a smidgen of hope, because I wanted him to make sure that there's no guarantees. But he's incredibly motivated and has done a ton of research, and uses all kinds of holistic methods to try to keep healthy. And of course, vision therapy just augments all that. You know, if you try to eat healthy and try to keep healthy, and you're motivated to get better, anything is possible, right?
Yep.
And
Well,
I was
yeah, it
very,
definitely helps for sure
yeah,
to
I
have
was
a,
very surprised he actually showed the field test, the before and after. I think the second one that he showed was the most recent one that he did. Actually, he's done another one this past Monday, which was also incredibly good. He is so close to passing the driving requirements. And that was his main goal,
mm,
you know. So
beautiful.
there are specific requirements to pass for the driving if you have lost your vision, which is different than if you go to get a license initially. If you go to get a license initially, you just go to the ministry and you read the letters, and they flash you a couple of lights on the sides, and if you pass, you're good to go. But if there's a medical condition that causes you to lose your license, then there's a whole process. It's much more difficult. There's a whole panel of doctors that need to look at the medical condition and the improvement and how good the visual field might become, and it has to be repeatably so. You can't just get it right the first time and get your license back. So it's an incredibly arduous and difficult process. And
Uh,
so is the vision therapy. So
yeah. Well, it's really neat to see that he has improved as much as he has, and
yeah,
yeah.
and I certainly believe that vision therapy is one of the pieces of the puzzle,
Right. A
along with it's a
combination there.
combination of including the SunPower LED. And when he came in for his follow-ups, he mentioned that he's using the red light helmet. And I do employ vision with vision therapy, light therapy in the office of different
Right.
frequencies. And so that's not new to me. And so when he was talking about the helmet, I thought I'd reach out to you. And interestingly, I've reached out, didn't get a response, and
Oops.
I reached out again. And when I was off on a mini holiday in November, right?
Yeah.
We connected via phone, and you had said you're a very busy person, so the only time I can ever talk to you is if you're on holidays. So and then you said, well, I'm going to Florida, and I'll be there for a few days. And I said, oh, I'm in Florida. So why don't we meet up? Nevertheless, then you gave me the palm to try it out. So we tried it out for a few days with my husband. And when I came back home, I decided I'm going to get a helmet and start using it on family, friends, patients, and maybe do some research.
Mm-hmm. Okay. Have you, in using either the palm or the helmet, anything has come up that you've noticed somebody else improve on in some kind of condition?
I think mental clarity, perhaps. Like when I personally use it, I feel like afterwards, I take it off and it's like, oh wow, I just feel
Yeah.
more energetic and
Yeah.
more, clear, I suppose.
I'm not sure if you were able to watch one of our other webinars. It goes back a while ago, but was with a Bill Nye. Not Bill Nye. Bill. Anyways, he put the EEG machine on the brain, and we did that. Oh, Alex Nye.
I think I did.
Yeah,
Yeah.
and so we were able to see
Yeah.
a change immediately with
Remind me
like
what
during
date that was.
it's about probably 4 or 5 weeks, maybe a little
Okay.
longer. I'm not
Yeah.
sure, but it's
I
it's
seem to recall
Alex Nye,
perhaps.
and it
Mhm.
it's on the if people go to YouTube, and there's a lot of videos there, easy to find and search. They can see that video as well. But in 3 minutes, we changed the brain pattern to where there was a much more relaxed state. And apparently, in that relaxed state, when you're that way, you can actually fire better to think things through. So that's interesting that we
I'm
were
going to
able
go
to.
back and look at that because I think that would be helpful to show maybe patients ahead of time that, you know, changes are happening even if they don't necessarily notice it at the moment, which is very common with light therapy, by the way. We do light therapy in the clinic, and they come in repeatedly for therapy, and then I see them afterwards, and I check their vision or their dry eyes, and sometimes they will say, oh, it was very relaxing and I don't think I noticed very much. And then I look at their eyes and they look better, or I check their vision, and a lot of the times, I wouldn't say all the time, but a lot more than I anticipated. I actually get improved vision and visual acuity. Yeah.
Right. Well, we have Dr. Margaret Naser, who was able to see for dry macular degeneration an improvement, and we have some other people that are watching
Yeah.
tonight that have seen improvements with dry macular degeneration. By the way,
Yes.
that thank you, Faith. That webinar was done on January 13th,
Okay.
and it's Alex Nye, Divergence Neuro. So. January 13th. Yeah, time moves along. So it's
Yes.
2 months
Thank you for
ago.
that. Yeah.
But
Yeah. So it's quite exciting because I do treatments for macular degeneration with microcurrent technology. And so this would complement that for sure.
yeah, we even have wet macular degeneration that I know of two cases where the floaters they basically disappeared. Their improvement on vision
Mhm.
was much better. The other one was one of our colleagues in um, Tennessee. His mother was diabetic retinopathy, and she could only barely read the top letter on the thing, the E
Mhm.
on that eye chart,
Right.
and she now can read 5 lines down since using and that was over the course of about 2 months. she was able to clear up
Well, it
after
makes
her.
perfect sense because, it improves the circulation. And so, if you have better circulation and you have improved mitochondrial function and cellular activity, it's going to overall make things better. But the thing is, if you have pain, you notice it right away. But when the pain goes away, a lot of us don't realize it. We just feel better.
Yeah. Yeah.
Right? And
Yeah.
and then somebody has to say, did that change? Is your pain better? And they're like, oh yeah,
Yeah.
it is better. But it's not the same as when you first get the pain. It's a shock, and you complain about it. So I think a lot of patients will notice subtle changes over time that they don't necessarily clue in right away. Just like Robert said, I wonder how many things are better that are subtle that we don't even think about.
Right, right. The interesting one I had was people with, I'm working with some researcher out of California, and he has, for severe cases, old cases, like he wanted to start there. When I say old, it means not that they were necessarily very old, it was that their, let's say, radiation therapy for or chemotherapy was,
Mm-hmm.
10 years back or
Mm-hmm.
whatever. And so that's where he started. And the funny part was I had made this device and we're not at the stage yet where it's out on the market, but in the research phase. And it goes into your mouth and provides a very high amount of light into the mouth with the same type of wavelengths like the red, and
Mm-hmm.
in this case, just the red wavelength inside her mouth. Now she failed to use one little other attachment that I had that went in between the power cable and the unit, and she that would reduce it down to about a third of the energy going into the mouth. So that
Mm-hmm.
the whole idea was that it wouldn't get too hot in the mouth. And she said, I don't know. She called me one day. She says, I don't know if this is a problem, but this thing seems to be feeling pretty hot. And I says, oh, that seems strange. Like that shouldn't be that way. And she says, yeah, it's so bright that I see it in my eyes, and I'm concerned about my eyes. And I'm like from the inside of the mouth,
Mm-hmm.
she's
Mm-hmm.
through the palate of her
Yes.
mouth, she's lighting up her
Well,
eyes.
we're
Um,
90% water.
and, and I says, oh, okay, are you using this little attachment that's, oh, she says, I didn't use it. And I says, okay, that's why that should be used, and then it won't be so warm in your mouth. And I says, well, have you had any eye issues? And all of a sudden she went, I didn't I didn't even think of that. She says, I haven't had dry eyes.
Exactly.
I haven't had dry eyes for so long now, ever since I've been using your technology. And I've had that since she had
Exactly.
the condition. So here in 2 months' time, it cleared up her dry eyes, but through the palate of her mouth was the light coming up. It
Yeah.
wasn't going into anywhere in the
Right.
office. It was going up that way into.
Yeah.
Isn't that funny? That was really funny.
Yep. It
So
just
we
goes
do
to
have
show
some
you.
questions that have come up, and so I'm just going to try and answer a few of these, and I appreciate if you're able to stay on and
Sure.
answer maybe a question or two that somebody might have here. The first question is Radhika. I have an autoimmune condition called psoriatic arthritis with pain on my lots of my joints. Currently, my palms and fingers are swollen with severe pain. How long do I have to treat per session with a palm device? The palm device would be probably about 5 minutes in total per hand. Probably 2 minutes of red and 3 minutes of near infrared, something like that, or 50-50 in time. But that should be able to help. We've seen it help reduce the inflammation in the joints, and that usually helps reduce pain. Another question, based on today's talk, can I use the can I use just the head device to treat the pain in my whole body? As a matter of fact, so I'm not sure if you meant the helmet, but I was showing this as well. So this can be used to treat anywhere on the body. And it is possible, depending on where you are, we can get in touch with you about where you could possibly try out the device. If you can email us at info@SunPowerLED, we'll try and answer it, like give you an answer to that where there's a close place. By the way, Richard, if you don't mind texting us, we'll try and answer your question. I see your hands up. Radhika is asking, how long and how frequently do I use the helmet for brain fog? If you have a helmet, there's no problem using the helmet. I have some people putting their hands in the device or putting this over their shoulder. They can turn it sideways. They can treat their sinuses or their face if they want to improve things that way. Maybe collagen production for some wrinkle reduction or sinus issues. But you can also, I have people using this device and putting their knee in it or their foot. So it's possible to do all that. And you're getting, even if you, I have some people using this even for pain, like I've had somebody use this for treating their hip pain because they have it, and they used it for hip pain as well as I've had people use it for other parts of the body like shoulders and knees and that too. So just to let you know, that's always possible with this. We do have, I'll just mention too, we do have the what we call the mini canopy, which is this device here. And that can go up and down over top of a bed for getting a treatment in an area. So that has the same thing as far as there we go, where you can, it's always, our devices always require power. And if you don't plug it in, it doesn't turn on. There's the red wavelength, and it's considerable amount of light power, and the near infrared, which can't really see too much. There's just the little purplish dots, but I definitely can feel it. High amount of energy. Okay, let's see. Another question from Susan. Would a person with sorry, Dr. Sebestyen, this is from Susan. Would a person with scar tissue on the eyes benefit from the PBM? He presently has little vision. He has autism as well. I don't know I think maybe over long periods of time it could help cell regeneration. But what is your thought?
I think that, in my view, is that we can help viable retinal function and ocular function.
But if it's dead, there's nothing you can do.
Well, that's an interesting comment because, when somebody loses their vision via stroke, traditionally, they lose their license and they go see their eye doctor and they're being told, forget it, it's never coming back, right?
Right.
But if we are able to stimulate nearby tissue to work better, we can regain some function. And, I've had several cases like Robert where miracles have happened. And that's because, viable tissue can be woken up. You know what I mean? Like when it's not quite 100%, atrophied or gone, right? Like you can actually wake up tissue. If it's scarred for many, many years, I would assume that it would take lots and lots and lots of, treatments. Never say never.
Yeah.
Time can tell, right?
Yeah, exactly. And what's the harm? There's no harm here. That's
no, exactly. And it's the same with cataracts. I mean, I used to say to patients, I've never seen a cataract get better. It always gets worse, never gets better. But, if cataract is diagnosed and, the patient makes changes in their life and, tries to use devices such as this and as well other means like diet and, healthy lifestyle, you can go many, many years before a cataract gets so bad that it needs to have surgical extraction, right? So,
Right.
and I've had patients come in who have had cataracts, and I've told them years ago, and, they've come in and the next year, all of a sudden, I'm able to get them to see better than what I did the year before. And I think that's not necessarily, um, because the cataract itself looks like it's going away, but because things are functioning better. And so what's there is functioning better.
Yeah.
And we're able to get better results, right? That does happen. So, yeah.
Yeah, I did. As a matter of fact, I did have. There's probably two people on this in our webinar tonight watching that did have cataracts in both eyes. They had. There's it's funny the timing of this. They had surgery on the one eye to get rid of the cataract, and then they were going to do the other eye. In the meantime, they had bought one of the palm lights.
Mhm.
And I have been, as a standard protocol, even for the one woman that had the wet macular degeneration really bad, was just with the eyelids closed. I always suggest eyelids closed.
Yes. Yes.
Was 1 minute of the red and
Yeah.
1 minute
Eyelids
of the near
closed.
infrared. And anyways, both of those folks have somehow their cataracts disappeared. Don't know how that exactly worked out, but
Well, I'll give you my comment on that. I don't think the cataract disappeared.
you,
I do think though that
the
they
rest
may
of the
have
eye
gained,
improved.
yes, I do think that they may have gained some vision due to the light because everything else is functioning better. And one notorious thing that improves with biophotomodulation is dry eyes. And people don't realize that dry eyes can affect their vision pretty significantly.
Oh,
But
really?
the one analogy that I like to use for that is imagine your windshield is full of ice, right? Um, you can still add heat, add moisture, clean it, right? And you can get it back up and running quite well. And if you improve dry eyes, you can get pretty significant improvements in vision. And I think that even if you have cataracts, you know, you can, like I said, wake up the system and you can actually get better improvements in vision, not necessarily because the cataract itself has disappeared. Um,
Okay.
I'm I'm
Okay.
not sure I'm not
Yeah.
sure I've noticed that in my 30 plus years of practice. So
Right, right, right. But you haven't necessarily been able to have some people with some palm lights yet, so we'll have to see how that all goes.
no, but I
Definitely.
do light therapy for a number of years now,
Okay. All right.
right? So, I have some experience with different types of frequencies and
Okay.
so
All
yeah,
right. Well,
yeah.
at some point, those people that are watching, maybe they could reach out to me again, and what we'll do is we'll get a further analysis done somewhere to find out what's going on.
And I'm planning on doing that. I want to see what the helmet does and I will absolutely report back to you if I see the cataract going away or even improving, like not as noticeable. I will absolutely, let you know. I do believe that retinal function will improve, even if there may be some scarring, macular degeneration, can improve because I've seen it happen. And dry eyes definitely can improve because I've seen it happen numerous times.
Another question Marilyn was asking, and I believe that everybody is very different
Yes,
coming at the, so where something might work very quickly I know somebody that had improved even within a week, but somebody else might take 6 months. I don't think
true.
anyone can say necessarily, unless you can tell me that what is the time length for healing to take place. And okay, in this case, the person talks about dry macular degeneration. And I got to say, it's been very short amount of time that people have seen some improvements. It's been pretty amazing.
I agree. I think weeks and months, like a lot of our protocols are, they go on for about 5 weeks at a time, and I do see improvements.
And can the palm help restore some hearing loss? And I got to say, we've been also able to see that as well. Some improvements now. A lot more to do with tinnitus, ringing in the ear. We've been able to see some great stuff with that. Significant reduction to even elimination of the tinnitus. But that's with about 3/4 of the people, and then there's another quarter that don't respond at all. There's no improvement. So I can't say why or what. Everybody's different. But
So I have a patient who I put him on because he has mild macular degeneration and tinnitus and blood pressure issues. And guess what happened? His blood pressure normalized.
Oh, that's beautiful. And
Yes.
it's amazing.
So I was treating the macular degeneration, but I got the blood pressure to normalize.
So people don't think of it, but the eye is a perfect gateway to
That's right.
the brain. So their
Yes.
light coming in from the front
Yeah.
could be very beneficial to certain things with the brain. And
Yeah.
obviously our brain controls the heart rate, but it's many more things than that. It's not just the brain, the heart, all the things that are connected affect the heart. But hey, this is pretty amazing to hear. Any problem with the light getting through the lenses implanted in cataract surgery? I
No.
will go for it. Yeah?
No.
No. And I would have to say the same from what I understand about light properties. No issues there. I have, just because it's an odd question, I've had people say, well, what about if I have screws in my leg or a plate? Well, if they have a plate, then that's going to block the light from one side. But people have used it on all kinds of places where they've had artificial parts in their body, and there's been no issues. Oh,
I would like to just point out what you did, because I see comments about the eyes, about the front of the eyes closed.
yeah. Oh, yeah, absolutely. Once again, eyes closed. And the reason I really like not only does it work out well with the numbers when you calculate what kind of energy you might be getting at the back of the eye, but that eyelid does such a beautiful job of diffusing the light so that the light becomes so even towards the back of the eye. There's no way of having any hot spots then, with the eyelids closed. So that's why I really like it that way. And now Betty is asking, what about shining the light through the side, versus shining it directly in front? And as a matter of fact, yeah, light will. As a matter of fact, if I put it on the side here, I can block off all the light going into from the front of my eye, even with something very, very heavy, and I will still see light coming in that way. So if
Yeah.
that is definitely with our device, there's enough energy there to go through the sidewall here.
Mhm.
Okay, let's see. I think we're wrapping up here. Let's see. I think that's it. So I want to encourage everybody to watch our next webinar next Tuesday night. And also, please go to our YouTube channel and see things there. And I want to thank you, Dr. Sebestyen, for coming on tonight. This was phenomenal. I really, really appreciate it to
Oh,
get
you're
your
welcome.
insight on this and to see one of your patients improve. That was fantastic. So
If
thank you for.
anybody is interested in, wanting to know more or, treatment wise, they're welcome to, you can provide them my address and
Okay.
phone number.
All
Yeah.
right. Okay. Yeah, they can just go to email us at info@SunPowerLED and we'll forward it
Yeah.
on is the
Thank you.
easiest way to do that. Yeah, so I just want to thank everybody for joining us today. And I really hope you have a fantastic week. Join us next Tuesday. And also, like I say, go to the YouTube channel. Please subscribe. Please also hit the like button because when you hit that like button, more people find out about what we're doing. So next week we're going to have another excellent webinar. So thank you again, everybody. May
Thank you.
God richly bless everybody on this webinar tonight. Thank you.
Thank you.
All
Thank you.
right.
Good
Bye
night.
for now.